Konnichiwa. Welcome back. Dr. Braces here. Thank you so much for tuning in. Today we're going to talk about a very important topic. How do I brush my teeth with braces? Now the challenge here that comes into play is when we have braces, they get in the way. And so it's much harder to keep your teeth clean. It's much harder to clean around the braces, and it's much harder to get to the gums, which is where we see a lot of problems in most patients. So first, let's talk about why it is so critically important that you take care of your teeth while you have braces. For patients that take care of their teeth and they do a good job brushing, the teeth, when we take the braces off, they look beautiful, they look gorgeous, no stains, cavities, things like that. But for those patients who don't do such a good job, two critical things usually happen that cause big problems. Number one, the gums get very big and puffy and swollen. And number two, around the gums and around the brackets, they will get what we call decalcification lesions. What that means is the enamel in the tooth is starting to break down, and it's starting to calcify, and those are causing these white stains or white spot lesions, and those are permanent. They don't go away, and they don't look good at all. And so again, if you're not doing a good job brushing and flossing and taking care of your teeth, then you're going to end up with those decalcification lesions, those scars on your teeth that are permanent, and they don't go away without doing some sort of dental treatment on them, like getting a filling done or getting crowns or veneers. Okay, so with a manual toothbrush, non-electric brush, what you're going to notice is that when you brush your teeth like you normally would, what is the problem that we see here? The bristles, they don't touch under the wire, and they don't touch along the gums. And so when you have patients with braces, a lot of the times the area where you get plaque built up is right here around the brackets and right along the gum lines, and the gums get puffy. And so with braces, it's very critical and important that in each individual spot, you take the toothbrush, you work those bristles under the wire, and then you wiggle, wiggle, wiggle. Then you go to the next spot. You work those bristles under the wire, and you wiggle, wiggle, wiggle. And you do that on all sections of the teeth, okay? You're also gonna brush how you would normally brush, right along the chewing surface and inside, and get all the surfaces inside of the teeth, okay? The last step that you want to take is you want to make sure that you go and spend some time along the gum line, because again, with the braces get in the way, and so the toothbrush can't reach those areas. So you have to spend time along the gums, gentle circular massages along the gums, and then again, working that toothbrush under the wire and wiggle, wiggle, wiggle. That's the technique you're going to use with a manual toothbrush. Make sure you're getting those bristles under the wire. Make sure you're brushing gently along the gum lines. Now, this is a good point, a good segue to talk about the type of toothbrush, because there's different levels of hardness when it comes to how hard these bristles are, right? So there's extra soft, there's medium, there's firm, and extra firm. You always want to be in the soft or extra soft range, because when you're brushing along your gums, those bristles need to be soft. If they're medium, hard, or firm, it's going to cause a recession along your gums, and it's going to make it where your gums start to recede just from the impact of those hard bristles on your gums. I always say hard bristled toothbrush, that's for cleaning and scrubbing tile floors and toilets, not for teeth and not for gums. So when you're using that technique to brush along the gum line, you want to make sure that you're being very gentle along those gums. Now, if you already have gingivitis, if your gums are already puffy, if you haven't had good oral hygiene and you're trying to make a change, when you brush along those gums, guess what? They're going to bleed. They're going to bleed. And that's your body's way of telling you that there's an infection there. It doesn't mean stop doing what you're doing. It means continue doing what you're doing. So when you're brushing your gums and you see bleeding, that means that you need to keep doing that, keep brushing those areas, keep massaging those gums. And once those gums get healthy again, guess what? That bleeding is going to stop. Another question that I get a lot is, do I need an electric toothbrush when I have braces? And the simplest answer is no, you don't actually need one as long as you follow those steps that we talked about in the previous segment, but it certainly does help. And the electric toothbrushes are great for a couple reasons. They're going to be a little bit more mechanically involved. So they're going to clean your teeth better I think the main feature for me is they'll have a timer. So it gives you a 2-minute timer. So when you turn on your electric toothbrush, the timer starts and it'll beep every 30 seconds. That's whether you use Oral-B or Sonicare, that feature is in place. And so what I found is that when I use a manual toothbrush like this one and I brush my teeth and I actually time it, I think I'm going for 2 minutes, but it's usually about 40 seconds. And if you want to take that challenge, go ahead and try it and leave it in the comments for how long you actually brush through your normal brushing routine. I'm guessing it's probably under a minute. So one of the great things about the electric toothbrushes is they have the timer, and so it's going to make sure that you do that full 2 minutes. Now, how to use the electric brush when you brush your teeth. The electric toothbrush that I use, the two main brands out there are Oral-B and Sonicare. Sonicare is one that oscillates and it does these micro vibrations that help blast that plaque off the teeth. The Oral-B also has vibrations, but it also rotates. And so here's mine, and you'll see it spins, right? It spins. And so both of those toothbrushes have special attachments for braces. So you can buy those and it helps get even closer and more intimately along the braces and along the wire. So how the electric brush works, you want to do it the exact same way as you do the manual brush. Now with the electric toothbrush, it spins, and so it's going to clean around the braces there a little bit better. See that rotation that we get with the Oral-B? And so for this one, you can put it right on top of the brace and let it go. Right on top of the brace, let it go. Right on top of the brace, let it go. One feature of the Oral-B I like is if you push too hard, it's gonna turn red and tell you that you're pushing too hard. Why is it important to not push too hard? Because if you do, you're then potentially damaging the gums. So always keep that light green, clean around the braces, just like that. Spend some time going along the chewing surface, just like that. Spend some time going under the wire, just like that. Cleaning around each bracket and then along the gum line as well. And if you take those extra steps, that's very important. And that's how you do it with an electric brush. So there you have it. That's how you brush with braces. I hope this video was helpful, especially for those of you that are experiencing braces now or are going to have them in the future. Please let me know if you have any questions in the comment section. Make sure to like or subscribe if you want more orthodontic tips. And speaking of having good oral hygiene, brushing is only half the battle. Remember, flossing is also extremely important. We've got a video on what's the difference between water flossing and string floss with braces. So check that one out. And again, thank you so much for tuning in. Remember, smiles change lives, so keep smiling.